Hi everyone up there at Natural Fitness. Firstly, I just want to say thank you for just giving me the chance to have a quick yarn with you guys about what you're going to be doing, and also finding a way that I can assist in somewhat to help you guys limit injuries and also just get through it without causing any issues that might be a problem down the track as you move on through each session with the guys up there at Natural. I love what the plan is with you guys and working predominantly on functional movements. It's not just a bit of a vogue topic at the moment, it's something that's actually really relevant long-term wise, because functional movements truly are what it's all about. Getting into a gym and just grinding out on one machine is well and good, but you don't utilize the muscle in that way. You don't utilize fitness in that way often in day-to-day life, and often in the tasks that we do, things need to be more functional, and that's a lot of the reason why CrossFit and things like Natural are doing have become much more to the forefront, because it is a much better way to train. One of the predominant things that I want to talk about in this session just briefly with you guys is knee injuries and knee movements, because I want to equip you with the knowledge that as you're doing the sessions, you can be aware of the position your knee's moving while you're doing jumping, squats, even running, any movements really that require load through the knee, to minimize the potential of any knee injuries in there whatsoever the best we can. A lot of the latest research indicates that about 72% of knee injuries can be limited through good education and through good functional movement, moving in the way that the knee actually is designed. So I'll go through a few of those things. I'll also talk a little bit about the anatomy of the knee briefly, and then talk about things to look out for, both for you guys and also for the trainers, so that we can prevent anything happening and also just get the best possible outcome of what you guys are doing. First of all, the knee itself. I won't get the skeleton over, it's just too far away, but the knee itself, you've got the top part of the femur, the bottom part of the tibia, knee joint in the middle. The most relevant to you guys anatomy parts of the knee are on either side of the knee. We have two main ligaments that act like struts down the side, and then internally you've got two main ligaments that are your two cruciate ligaments that also act to give you internal stability within the knee. And then on the bottom surface of the knee joint, you've got your cartilage and your meniscus. And this is the surface or the part that most predominantly gets worn down through arthritis, or also where you get tears to the actual cartilage. And generally a tear or even arthritis comes along because of incorrect movement or incorrect loading of the actual knee joint. The biggest thing that you guys are going to find really is that when you're doing squats, when you're doing lunges in particular is a good one, or step ups, jumping, burpees, anything like that, look down occasionally and watch the direction that your knee is moving in. Most people, or pretty much everyone actually, your anatomical position of how you should stand and move is in fact not with your feet nice and straight. Your feet should be flared out slightly, about 10 degrees. So if that's 0, about 10 degrees out. And your knees should move in that direction. So when you're doing your movements, we don't want your knee going dead straight each time you move down into a squat. We actually want it to slightly flare out by 10 degrees. Now, if you're doing repetitive movements and you're constantly, I might actually try and demonstrate it. You can see my knees from that position. If you are moving so that your knees are moving dead straight each time, going back and forward like that, you'll find if you then add load onto that through dumbbells or barbell or any other means, you're actually putting huge amount of load on your medial collateral ligament. So I might just draw it for you now, just to give you a quick explanation of what I'm referring to. So that is a front view of your knee. We've got your patella or kneecap sitting there, and then on either side are these strut ligaments that I'm talking about. So medial, meaning inside, medial collateral ligament. is that guy right there. If your knees are constantly moving straight in that direction and not flaring just slightly, you actually put excessive load on that ligament and the risk of developing like a tendonitis in it almost. And then also the risk of degenerative tears can occur to that. But also the main thing is the inside surface of your knee joint gets a huge load on it every time you're doing that. When we want the load to be nice and even across the whole knee joint, you don't want all that pressure going through one spot. About 98% of people with arthritis, if you were to ask them about it and they've seen their x-rays, it's normally always the inside part that is significantly worn down, and that's because biomechanically they've been moving incorrectly for quite a while and they wear that side down so much faster. And we want to limit that with you guys to get you moving the best way we possibly can to prevent any of this happening. The third issue that is a possibility that some of you in the group may have even experienced in the past is kneecap issues. If your knee's moving slightly inward or even straight, again, the knee moves in a poor position so that when the kneecap comes under load, it actually pulls your kneecap to the sides too much and starts to wear the underneath surface of the kneecap. And then that starts to get sorer and sorer and sorer. And that's when you get anterior or front knee pain with your squats and your lunges. So if you're experiencing a little bit of that, let the trainers know straight away, because that's one of the things that may be starting to happen. You should have zero pain in your knees when you're doing all of these activities. So those are the main things we're going to try and limit and prevent with you guys. So just to make you aware of them. So the best ways to prevent and limit that from happening is to have your knee moving in a beautiful direction, the way that it's designed to move. So just rehashing, that's flaring out slightly by about 10%. Don't move dead forward. And worse than forward, actually I should have mentioned, is actually gliding inwards. So if you're doing your squat or even particularly a lunge, when you lunge forward, if your knee's going in that way at all, that creates a huge angle on the knee joint. And repetitions of doing that, while you're doing it in a class, you may not even really be that aware that you're doing it. And you may not feel too much at the time, but with repetition, week in, week out, it will start to become problematic, and that's what we want not to happen. So, what are the causes is the next thing that I want to talk about with you guys. Now there's a number of causes, but the two most common causes are firstly overpronation. Actually, I'll grab this foot here. So that's a left foot. Overpronation is when the foot rolls in too much on the inside, so your inside arch flattens and you roll in too much. The way the foot's designed, that'll make your shin bone rotate internally, and then that will bring the knee inwards as well, and that can be one of the things that leads to all of these problems. So firstly, good footwear. Make sure your shoes are relatively up to date. They're at least within 3 years old. And if you use them heaps, you should be renewing your shoes even more. If you're concerned about it, have a yarn with your trainers, get them to have a quick look at it and say, oh, you probably could do with a new pair of shoes, or something with really good arch support or good footwear so that you're not doing that. It's not going to promote that. But the second biggest cause, and this is something that is really important, is your bum strength, is glute strength. The glute muscle on the back here is one of the biggest external rotators of the knee and of the leg. So when you're doing these things, it's your bum's job to glide the knee to go out into that 10 degree kind of movement. It's the bum's job to move it in that direction. So if you have weak bum muscles, weak glutes, you'll find it's very difficult for you to hold your knees out and do a proper squat or a proper lunge. Naturally, your knee will keep moving in. So one of the issues there is we don't want to be training heavily, or we don't want to be loading your knee up with excessive load, whether it be whatever, while you're doing these exercises, while the glute is insufficiently strong to stabilize the position that your knee's going in. So if you find that your knee is dropping in slightly when you're not really paying attention, or even if the trainers notice that your knee is dropping in a bit internally, coming in a bit too much when you're doing things, or even too straight, it's not flaring slightly, have a chat with them really quickly that they can incorporate stuff into what you're doing to focus more on the bum, so we can get your glutes nice and strong so they're sufficiently able to carry out the task that your knee wants to do. Because if they're not strong enough, your knees are going to move in and you're going to start getting sore. It's almost inevitable, and we want to avoid that as much as we can. So if in doubt, have a yarn with either the trainers, and also the trainers, they're going to be looking and keeping an eye on you guys and seeing if you're dropping in heaps, they may suggest that you don't drop in too much and try and do other strengthening exercises. So that's one of the main things to really take out of this, is just to be aware of that knee position to make sure that you're not dropping in too much. And if you are, consider, do I need better footwear to lift me up a little bit more, or do I need to focus more on doing some glute strengthening exercises before I push forward and start doing squats, lunges, anything especially with added load that are going to be loading down on your leg. So guys, thanks heaps for listening to me. Just a quick blurb about myself, which I probably should have said before we started. My name's Aaron Babb. I work and own the clinic downstairs called Avon Physiotherapy. Been a physio now for about 12 years. I hold a bachelor's degree in exercise physiology and a master's degree in physiotherapy. Love the knee. We do tons of work with the knee, and we want to protect your knee. So with everything you're doing, make sure you're just mindful of this stuff, really. So that's it for me. I think our in-house dietitian is going to be coming and talking to you guys on the 6th of March, I believe. So I might even pop up and hopefully meet some of you guys then if you're still there. Anyway, thanks again guys. Thanks for having me, and I might pop up and see you all at some stage.